All right. So I'm going to start with the story from the Commonwealth Fund, a story about Isaac. Quote, in February 2010, 13-month-old Isaac lost his health insurance and the life-sustaining medical equipment that his insurance plan paid for. Born in 2009 with esophageal atresia, Isaac had exhausted his lifetime limit before his second birthday. 6 weeks later, the Affordable Care Act became law, and Isaac regained coverage that protected him and his family against lifetime maximums. This is just one of many examples of the families that the ACA has helped. The ACA is beneficial to the United States healthcare system because since its implementation, it has given many more people access to affordable healthcare. Throughout my speech, I will compel how the ACA has allowed more people access to healthcare, how it has made healthcare more affordable, and the reasoning why people are no longer denied coverage. My first point is that it reaches more people. So one of the parts of the ACA was Medicaid expansion, and before the implementation, Medicaid was used to just restricted to women, children, disabled, and elderly people. And a quote from Cato said that after the ACA implementation, quote, low-income adults with incomes at or below 138% of the FPL who were not elderly, disabled, or parents of a dependent child became eligible for Medicaid coverage. So basically anyone who was not making enough money and was in the low income bracket was now able to get allowed young adults to stay on family plans to the age of 26. So I'm sure we're all aware of like graduating college, trying to get a job, trying to get healthcare right away. That's a lot to handle. So being able to stay on a family plan to the age of 26 is absolutely amazing. A quote from Christina Link Young, who is a fellow at the USC Brookings Schaffer Institute for Health Policy, says, well, that reaches a very targeted group of people. There are a couple million young adults who would otherwise be uninsured who have gained coverage under that provision. So just the expansion of the ACA, the amount of people that it covers is just absolutely amazing for so many different age ranges. My second point is that it's more affordable. So I have a couple of stats from the Brookings Institute. So in its rollout in 2014, quote, taking these trends into account, at least 4.2 million enrollees are newly covered in this market, as well as, quote, the share of uninsured has fallen by 40% because of the Affordable Care Act. So you can see that because the Affordable Care Act, a lot more people are able to have access to it, meaning they can now afford it, that our uninsured rate has fallen by 40%, which is just absolutely amazing in the short time that it has actually been implemented. And then the New England Journal of Medicine says, in its current estimate of Medicare spending in 2020 is more than $200 billion, 20% lower than it was immediately before the enactment of the ACA. So even Medicare spending is a lot lower than it was before the ACA. So you can see a lot more people have access to actually afford healthcare when they can see a doctor and go to the hospital and not have to pay out of pocket. And my last point is that people are no longer denied coverage. So before the ACA implementation, people with pre-existing conditions, insurance companies had the right to deny them coverage. And after the ACA implementation, that is no longer legal. So Christina Link Young also quoted that anybody who doesn't have another source of coverage has the option to go into the individual market and buy coverage directly from an insurance plan. Significant reform that makes the individual market accessible to everyone, even those with healthcare needs. So if you're not eligible for Medicaid expansion that has become part of many states, you can even go into individual market, which is private insurance, which is great, and they can no longer deny you coverage based off pre-existing conditions that you have. And then going back to my introduction story of Isaac, who reached his lifetime limit of insurance by the age of 2, which is a toddler, which is crazy. If it wasn't for the implementation of the ACA, they could have very much so not been able to have access to healthcare. And he's now at the age of 11, has access to healthcare that his mom can actually afford. So based on his pre-existing conditions, 6 weeks after, they're really lucky that the implementation took so soon after their healthcare kind of cut them off. So throughout my speech, I have talked about why healthcare is beneficial to everyone. I talked about that it reaches more people. The costs are now more affordable to actually get healthcare, and there's no more limit to pre-existing conditions, meaning that insurance ACA has helped more people around the U.S. gain good healthcare that they otherwise would not have been able to access.
So while Simone makes many valid points arguing for the ACA and why it's a more successful reform of healthcare in the United States, I am arguing in opposition to the ACA for 3 main reasons, which I'm going to discuss further in my argument. And I think that the main question at hand is really, did the Affordable Care Act actually usher a revolution in US healthcare? We're now 10 years after the law was enacted, and I think it's fair to say that the ACA has fallen short of achieving some key health reform goals. And arguably the primary focus of the ACA was to increase the number of Americans with health insurance coverage. However, it's kind of fallen short in three main areas. One, it caused higher premiums. Two, taxes have significantly increased. And three, it has had a devastating impact on businesses, specifically smaller businesses. So for my first main point, it's that the ACA has caused higher premiums. And because the ACA allows insurance companies now to provide a wider range of benefits and cover people with pre-existing health conditions like Simone talked about, premiums have risen for the people who already had health insurance. So right now in the US, the workplace is the primary source of insurance, with 49% of Americans being covered by employer-based plans. And after the ACA was enacted, the average employer-sponsored family plan premium increased by 9%. And at least 1 to 3 of this increase is attributed to the benefit requirements instituted by the ACA. Some of these benefit requirements included covering preventative care without copays or deductibles, and covering children without regard for pre-existing conditions. The Brookings Institution laid out the impact of the ACA by state, showing how the coverage and average monthly premiums and the average cost of insurance varied across the states, both pre and post ACA. And both of that monthly average of premiums and average cost of insurance increased over 60% of the states in the United States. So my second main point is that taxes are going up as a result of the ACA. So several new taxes were passed into law that helped pay for the ACA, such as taxes on medical devices and pharmaceutical sales. But according to the Tax Foundation, there were approximately 20 ACA tax hikes that resulted in an approximate $1 trillion net tax increase on Americans, including but not limited to the individual mandate noncompliance tax, medicine cabinet tax on HSAs and FSAs, and health insurance tax. So for example, in addition to mandating the purchase of health insurance through the individual mandate tax, the ACA directly increased the cost of insurance through healthcare insurance tax. And this tax was projected to cost taxpayers, including those in the middle class, $130 billion over the next decade. My last main point is that the ACA has had quite a dramatic effect on businesses, and this is more specifically small businesses. And this is due to the ACA's employer mandate. So for example, in the ACA employer mandate, a 30-hour week is considered full-time. So this has to force small businesses to cut hours, wages, and jobs. So businesses with more than 50 or more full-time employees must offer insurance or make payments to cover healthcare expenses for employees. So one of the congressmen, Jeff Duncan in the US, explains how if an employer does not offer health coverage and at least pay one employee that qualifies for health tax credit, the employer has to pay an additional non-deductible of $2,000 for all full-time employees. And if the employee actually receives coverage through the exchange, then the penalty for the employee on that employer rises to $3,000. So not only are these costly taxes taking a toll on small businesses, but businesses are really inclined to reduce their hours in order to find a way around this like 30-hour per week definition of a full-time employee. And so for these main reasons, which is that it causes higher premiums and taxes are going up, as well as the effect on small businesses, my argument is in opposition to the ACA. But now I will let Simone rebuttal my case.
So although Jules makes some good points, I think the main part of the ACA was the goal to get more coverage for everyone. Right now in this country, healthcare is a privilege rather than a right. And I think putting the ACA in place was a need to get more people healthcare. And I think that was their main goal to start with. So I know Jules, one of her points, talked about the tax increase. So I actually have a quote from the Economic Policy Institute saying that the ACA instituted a 0.9% surtax on individual earnings above $200,000. So yes, you are correct that taxes did go up, and that was something that they predicted. Taxes was just for people who earned over $200,000, which in most likely they can afford to pay higher taxes rather than people who in the low income bracket didn't have healthcare at all and could barely see a doctor at all. So you are correct in saying that taxes did go up, but I do think it's people who can most likely afford paying a little more taxes to give other people benefits of actually being able to see a doctor once a year. As well as you talked about the small businesses having problems with cutting back hours or increase in having to pay for private insurance. And although I think that cutting back hours is very sad for a lot of employees, I can't refute that. I do think that it is important to have healthcare insurance through your job, because that is a benefit that most jobs are required to have, is healthcare insurance. So they should figure, I'm not sure exactly how you get insurance as a business person, but I do know that when you're an employee, that is a benefit that you're entitled to, and not everyone who wants to. So being able to give insurance to your employees, they should find a way around having to pay more money for it, I think. But it is a difficulty to find the best balance. We all know that there's no perfect healthcare system, especially in the way that America is set up right now. But I do think the ACA did a good job in trying to find a way to balance access as well as taxes and premiums going up the best that they could. I'm going to give it back to Jules.
I definitely agree with you in some of that, but for the sake of this debate, I'm going to do a rebuttal against that. And I think really when it comes to the ACA, I think the main argument that everybody would argue for is that it's more affordable and it covers a lot more people. And that's true, but I think that you could also argue that health insurance only becomes more affordable to the people in the lower income bracket. So for example, the federal subsidies made premiums somewhat more affordable, and those that were even closer to the poverty line could get additional subsidies that really like reduced deductibles. But I think my argument is that for the American middle class, which is around 52% of the population, the cost of premiums and deductibles still remained out of reach for a majority of this population. And the ACA seems to have kind of divided the nation into two different like health insurance programs, with the ACA only kind of benefiting the lower and moderate income Americans. So I found this from the Kaiser Family Foundation that middle income Americans are still having trouble affording their coverage, especially due to what's called the subsidy cliff, which is those who make between 100% and 400% of the poverty line. We talked about this in class, that those will be eligible for the ACA subsidies to help pay their premiums. And in some cases, those out-of-pocket expenses such as like co-payments and deductibles. But if you fall outside of this, and that's literally even if it's just 401% of the federal poverty line, then you'll receive no subsidies and you can struggle to pay full price for the ACA compliant coverage. Also, some data from the Centers of Medicare and Medicaid Services show that the number of uninsured with incomes greater than 4% of the federal poverty line increased by 1.1 million in 2018. So this just shows kind of how the ACA created an entirely new class of uninsured individuals, among those with middle to higher incomes who don't qualify for these government subsidies and can't afford coverage because of these kind of skyrocketing premiums. So simply put, and in conclusion of my rebuttal, there are just too many people without subsidies who can't afford coverage under the ACA. So unless these issues are resolved, the ACA kind of falls short on this claim that healthcare is more affordable to the US population as a whole. That's my rebuttal.
Yay!
Yay, we're done.